Hey guys, Dr. Paul Endriss here up at CrossFit Mind Over Body up here in Thornton. And I wanted to talk to you guys today about anterior shoulder pain. I'm here with Yo today, the owner of CrossFit and Mind Over Body. And we wanted to talk to some things about like what can we be doing to correct our pain in the front of our shoulder. And what can it be? Bicep tendonitis, rotator cuff tendonitis, subacromial bursitis, or just an impingement syndrome inflaming some of the structures in the front side of the shoulder. We see this a lot with people who have internally rotated shoulders and a lack of overhead mobility, especially people who sit a lot, people who do a lot of working out, a lot of push-pulling type movements. And so today we just wanted to go over a couple different movements that we can do on our own at home to correct some of this anterior shoulder pain. One of the major muscles we want to consider in regards to someone with anterior shoulder pain is the lat. The lat is that big muscle on the back side that attaches into the shoulder. What we want to do is get the ball right into the back side of that shoulder, and that's right where those rotator cuff tendons come through, and that lat actually pierces the posterior capsule and stabilizes that shoulder. So what we want to do is, you see Yo is moving across, finding some gritty areas in there and working on some of those tender spots. And as you can see, shoulder overhead, and even depressing that scapula down. As you can see, she depresses the scapula in order to really isolate that lat and some of those rotator cuff tendons back there. Another important structure we want to consider is the pec. And the pec is the big muscle on the front side of the shoulder that does a lot of the internal rotation. So what we want to do is get Yo to put her hand up on the rig and stretch that forward. If you have anterior type shoulder pain, this position might actually be bugging it. And you can see how Yo's shoulder is actually forward and internally rotated. What I want her to do is depress her scapula down and now get a big stretch in there. And that should take away that pinch in the front side of the shoulder and get a bigger stretch in the pec. Another piece we want to consider is the thoracic spine. And the thoracic spine is coupled with the shoulder, because if we have an internally rotated shoulder, you can see how that can crouch and lose the curve of my thoracic spine. So just getting a foam roller, and we can see Yo how she's moving through some of those structures in her mid-back, finding the tight areas, and just working through there. Another thing that we can do to increase that stretch is grabbing the medicine ball behind her and going overhead with her arms. Be careful here of that shoulder, because if you get that pinch, depress the scapula so you get out of that pinch, increasing the stretch there. All right guys, thanks for tuning in. Again, Dr. Paul Endriss here. We just talked about some things we can do to fix some anterior shoulder type pain. Thanks again, Yo, for having us up here at CrossFit Mind Over Body. A great facility up here in North Denver, great coaching, great programming, a great sense of community. Do come check them out up here at 120th and Thornton.